Hi guys, welcome to my YouTube channel. My name is Taiwo Black. In this video we're going to be talking about a very common infection that almost all women will have almost have had at least once in their lifetime. It's called thrush or candidiasis. It's quite common actually. As a pharmacist, I've seen a lot of women come down with it, and some people mistake it for an STD. It is not a sexually transmitted disease. So if you have never had sex, there's every possibility that you can have thrush. In this video, we're going to be discussing the symptoms, why it occurs, the medications you can use, and how to prevent candidiasis from happening. So, candidiasis is a yeast infection that is caused by a fungi called Candida albicans. So candida normally lives in our body, like in the mouth, in the gut, in the stomach, and in the vagina, even on the skin. But what happens is when there's an overgrowth of this candida, it causes the yeast infection. That is when it's an infection. But normally we might just have it just laying down there. It doesn't cause any symptom. But when there's an overgrowth of it, that is when we have the yeast infection. What are the causes of candidiasis? Candidiasis can be caused by misuse of antibiotics. So when you use antibiotics when you're not supposed to use it, sometimes it kills the good bacteria in the vagina, thereby causing an overgrowth of this yeast, because the good bacteria were supposed to keep the yeast at bay. But when it kills the good bacteria in the vagina, there is an overgrowth of yeast which starts causing the symptoms. Another cause of candidiasis is when you're pregnant, because when you're pregnant you have hormonal imbalance, thereby causing rise and fall of the pH level of the vagina. So there can be an overgrowth of the yeast in the vagina. Some other causes of candidiasis might be diabetes, poor hygiene, and taking hormonal contraceptives, especially the oral pills. Another cause of candidiasis is immune suppression. So if you have diseases like HIV, cancer, or you're using immunosuppressant drugs like corticosteroids, and that's why we advise some women not to use dexamethasone at will, because it makes them gain weight. They don't know that in the long run it causes their immune to be suppressed, thereby causing an overgrowth of this yeast in the body. Now, what are the symptoms of candidiasis that you might experience? Number one is itching. My god, it has this crazy, Nigerians call it sweetie. When you itch it, you feel good when you're itching, but not knowing that you are peeling it. So it's going to get you to that point where you have this burning sensation. So that's one of the symptoms. Another symptom is whitish discharge. It feels like cottage cheese, that white lumpy discharge. Just the very thick white ones are symptoms of candidiasis. Another symptom is burning sensation while urinating, because the walls of the vagina have been inflamed. When urine passes through that place, it burns up. It's very uncomfortable. So when I see someone who has candidiasis, I feel so much pity for them because of the discomfort that I'm sure it's causing them. I've talked about symptoms of candidiasis. You might also have more symptoms. That is, you can have candidiasis and also have like an STI, other bacterial infection together. So you need a physician to determine that. So if you're having recurrent candidiasis, it might not just be candidiasis. It might be because there are also other things that your vagina has been infected with, other bacterial infections that your vagina has, and that's why it might seem like you're having recurrent yeast infection. So oftentimes when women come in to treat candidiasis, probably in the pharmacy or in the hospital, they're like, oh, what can I get for my husband to also treat his own, even if he doesn't have a symptom? I said earlier that candida naturally lives in our body, like our mouth and our skin, our gut, intestine, and all of that. So because you have candidiasis does not mean it automatically will have it. You might just have candida in the system, just like you have it when it was not an infection. He will just have it there in his body, and so far he doesn't have a symptom, it does not need to be treated, except it comes down with some symptoms. That is where you need medication, but aside that, it's fine. You can continue with your medications, and as soon as you're done, everybody's going to be fine. We're now going to be talking about the medications you can use to treat candidiasis. So because candidiasis is a fungal infection, you should know that you are going to use an antifungal to treat it. Antifungals like clotrimazole and all of that. It's best you ask your physician the best one for you to use. Most times you might think it's candidiasis and it is not. So except you tell your symptoms and they send you for a lab analysis, you might not know. But there is a topical cream you can use. There is a cream you can insert, and there is one you can just rub on the vulva. Vulva is the outer part of the vagina. probiotics. Probiotics are the good bacteria, the live bacteria that can replenish the good bacteria that has been lost in our body. So because good bacteria has reduced, that's why there's an overgrowth of yeast. So if you can use probiotics for a while, it balances up everything, and so there will be no overgrowth of the yeast. The yeast can thrive well with the bacteria together. So probiotic is also one very good medication for candidiasis. Another non-medication I'm going to mention is yogurt. Yogurt also contains live bacteria. It's also a probiotic. Yogurt, cranberry, very effective. You can, as a woman, you can be taking cranberry to help replenish the good bacteria in our body, and you feel better. And if at all you've been having recurrent candidiasis, like you've had it more than 4 times in a year, definitely you need to see a physician. You cannot just go use an over-the-counter medicine just because you know that that's what is being used. It's better you see a physician to diagnose what exactly is making it to be consistent or making it to be reoccurrent. And what are the ways to prevent candidiasis? Because it's not enough to be treating vaginal thrush. You need to know ways by which you can prevent it. Number 1, so avoid antibiotic misuse. Number 2, avoid cleaning from back to front, that's from the anus to the vagina, because you can in that process bring bacteria that shouldn't be in the vagina. Another way you can prevent candidiasis is do not Dutch. Dutching means putting substances to rinse the inner wall of the vagina, that is inserting stuff like this into the vagina, with soap and water. The vagina, you need to know that the vagina is self-cleansing. You do not need to help the vagina clean itself. It will clean itself. All you need to do is just wash the outer surface of the vagina, that's the vulva. Avoid inserting anything to clean inside the vaginal walls. That can cause an overgrowth of yeast, and you just keep getting candidiasis because you're going to be washing away the good bacteria in the vaginal wall. Another way to prevent candidiasis is avoid using perfumed products, perfumed soap, medicated soap to wash the vulva. Another way to prevent candidiasis is avoid inserting anything they tell you helps to tighten the vagina or whatnot. Some people use alum, some people sit on hot water. Those still kills the good bacteria, and you just find that you're having recurrent candidiasis, recurrent vaginal thrush, which shouldn't be so. Okay, yeah. So if you have any question, please leave it in the comment section. If you have anything to add, please make sure you leave it in the comment section, and I'd appreciate if you give this video a thumbs up, and you subscribe to my YouTube channel for more videos like this. I film about pharmacy, faith, and lifestyle, so this channel is never dull. Make sure you hit the subscribe button, okay, and share to people around you. Thank you for watching. I'll see you in my next video. Bye.